In this video, we will discuss the need for coaching parents to use evidence-based practices. Okay, so before we get started, let's discuss some terms that we will use in this video. Instructor is referring to a caregiver or an educator, and a learner refers to a young child, a teenager, or a young adult. Recently, the Center for Disease Control released statistics which indicated that the prevalence of autism spectrum disorder among school-age learners has increased dramatically. Specifically, they noted that the prevalence has increased from 1 in 150 children identified in the year 2000 to 1 in 44 children identified in the year 2021. Researchers have looked into possible factors to identify why there has been a rise in autism spectrum disorder prevalence. And one researcher, Kumar, in 2021 stated that the rise in diagnosis has not been due to the increase of more children being affected, but the increase is due to increased awareness among the population, more comprehensive screening in terms of, well, baby checks, improvement in the access to healthcare, and updates to the criteria for diagnosis. In addition to the perspective that has been expressed by Kumar and others, there has been other perspectives that have emerged with this data coming out in the research. So, for example, one positive way of looking at it is that more accurate identification of autism spectrum disorder allows caregivers to obtain earlier diagnosis and then to begin evidence-based practices such as applied behavior analysis. And applied behavior analysis has demonstrated to be very effective in this group of learners. Another perspective that has been emerging in the research is that although there has been an opportunity for an increase in earlier diagnosis, there unfortunately remains a problem in disproportionate identification and access to services among minorities and individuals that live in rural areas. So, for example, the research indicates that families who are living in rural areas or experiencing poverty are more likely to underutilize early intervention services or to receive a lesser amount of those services in terms of shorter sessions or fewer sessions than they typically would have gotten if they were not experiencing those difficulties. So what I am referring to when I say difficulties or the obstacles that families are experiencing is caused by workforce shortages. So there has been an increase in the need of service providers, and these shortages have caused significant difficulty for families to access services. Additionally, for some families, the travel time is excessive. They're spending hours driving or using other routes to get to clinics and hospitals. And this can get expensive not only in terms of paying for the traveling, but also time away from work to go take their child to these services. And then also additional expenses such as co-pays and things like that make other obstacles that families need to try to navigate in order to get proper assistance for their children. So the end result of these shortages and scarcity of service providers and other obstacles have led parents of young learners to report that they are trying to cope with significant stress in regards to sufficiently meeting the needs of their children. So given that a majority of a child's life is spent with their caregivers, If we are to approach this from a family-centered perspective, then it's critical that we coach parents how to implement evidence-based interventions that they can use at home with their children. This can also lead to the parents feeling more empowered to advocate for their children and to be a force of change in their homes. So I would like to end this video by staying positive and reiterating that there has been several methods that have been effective and are considered evidence-based for this demographic of learners, and that parents have successfully been coached on how to implement these strategies in the home.